everyone. Welcome to Health Impact Live Digital Health Talks. This is Megan Antonelli. This year, the Change Healthcare breach sent shockwaves through our industry, exposing critical vulnerabilities in healthcare cybersecurity. Today, we're joined by my friend and Health Impact partner, Rob Sebaugh, Health Identity Strategist at SailPoint. We're going to examine this watershed moment, talk about all the other things that happened this year, and how organizations can protect for this new threat landscape in 2025. Hi, Rob. How are you?
Hi, Megan. I'm doing great. Thank you for having me.
Yeah, it's good to see you. It's been a few months, and it's been a big month for, big few months for healthcare and security. Some good, some bad. But tell us a little bit, for those who don't know you, tell us about your background and what you do there at SailPoint.
Yeah, great. So as Megan said, I'm Rob Sebaugh. I'm the healthcare strategist at SailPoint. My role focuses on really helping healthcare organizations understand what an identity program journey looks like, what business values behind that, how we really look at that through the lens of securing an organization, but still also being an enabler to the healthcare industry. There's so many interesting complexities in this environment, and so I love getting into the details on it all. Prior to working at SailPoint, I led an identity team for just the largest provider of government-funded health insurance in the United States. So we were responsible for about 20 million lives at the time from a membership perspective. So look, I've seen the lens of the payer, the lens of the provider, the lens of the IT security professional, and there's a lot of work to do, but there's also a lot of exciting things going on as we continue to try to improve and protect and not have events like we had with Change, right?
Yeah. Yeah, no, I mean, I think it's so interesting, and we've talked about it a lot in terms of just how significant that Change Healthcare breach was. It certainly wasn't the first, and it obviously wasn't the last, but it really did, create shockwaves, and, people started paying attention. Why do you think it took something that significant to kind of wake everybody up to this issue?
Yeah, and arguably wake everybody up again, right? So if you go back about 10 years prior to this event, we had the Anthem event, right? And that was almost as big as this one. I mean, scarily close. And then here we are 10 years later, and you start to go, hey, what are we getting wrong here? This keeps happening, right? But just to be candid, a breach at that scale really it's hard to ignore. I would also just make the statement that, look, I don't say any of this about Change. I've not worked for Change, right? But this is all just kind of through the lens of, hey, what can we learn from it? And I know there's a lot of people that worked very, very hard before, during, and after this event. The reality is the outcome is an estimated 100 million records, breach, right? Those are records on American lives. That include both PHI and PII, and for those that maybe are unfamiliar, Change Healthcare operates at that intersection between healthcare and finance, right? So they do a lot of what's called clearinghouse activities, where we're kind of pen paying, denying claims, right? Like what's going to go through, what's not, what matches, what should be on this, what shouldn't, et cetera. And there's a lot of work that goes into that, but they work as an intermediary for so many systems. What we saw was this single point of failure and the downstream effect that happened from it. So I think what we see is this this interesting curve of, as we want to integrate and build our businesses and grow, right? We've got to be very conscious of the role we play in that supply chain, especially for critical infrastructure like healthcare. And then not to take a hard turn, but if you really just kind of think about our healthcare industry at large today, things like this just continue to fuel that fire of frustration. And we've seen some very unfortunate events in recent news that I would say is also an attack on the system. And we continue to see these breaches, and we continue to see disclosures. And so I think there's definitely some help. And so I think forums like these tend to give us an opportunity to have a voice and start to really have a conversation around what we can do about it.
Yeah, I mean, that's a really good point. And I mean, it's basically, to some degree, like the healthcare system is under attack, and whether that's by, outside or inside, we've got to figure out how to protect it. And that, I think the recent incident does show that. And certainly it's tied to some of the vulnerabilities that exist. So, but in terms of that, the Change Healthcare breach, tell me a little bit about, I think it expose sort of specific gaps, as you mentioned, as sort of this intermediary. I've heard a little bit about people, in terms of just your partners and when you're looking at your third party administrators and what your relationships are with them, and let alone mergers and acquisitions and all of that. Tell me a little bit about, what you've been seeing with your customers and clients in terms of how they've responded.
Yeah. So look, third party, what I'll call third party identity is, one of the most complex and most complex challenges in healthcare, but it's also one of the most abundant populations. So if you look at coming out of the pandemic, we saw this massive influx in travel nursing, contracted physicians. Then we have to think about all those other functions of our supply chain, like the ability to process a credit card. Well, a hospital system doesn't do that on their own, right? They pay a third party to pass that through. And if somehow that third party gets attacked and somebody gets into the hospital system, guess what? You got another door, right? So this third party identity management challenge is just, it's abundant. It's everywhere in our industry. And you have to think about things like, I always talk about in terms of a life cycle event, right? So when someone joins your organization as an employee, you have the opportunity to go, okay, I'm going to do a background check. I'm going to make sure they're credentialed. I'm going to do all the positive things to bring someone in that I'm like highly confident I could trust, right? A non-employee doesn't get that necessarily, right? They may be on a contract through a third party. You may not even know who they are, but they have an identity in your system. And then how do you know that not only did they join, but how do you know if they left that company and if you've actually disabled that access, right? So when we think about this third party component, it gets to be really interesting. Again, in healthcare specifically, you extend that to all the IoT, your pacemakers and insulin pumps, and the list just goes on and on and on. So look, we've really what the Change Health breach really does is it reveals these vulnerabilities in this, like, it's insufficient vendor management or vendor risk management. We see a lot of legacy systems that still create a lot of risk. We see healthcare in general is lower in the maturity scale. I can tell you when I get the opportunity to speak with a lot of our customers and a lot of folks in other security-based industries, and healthcare specifically tends to be, we get really high in certain areas, right? We get really good at, maybe we're going to govern that PHI because that's what HIPAA says we have to do, but we don't put MFA everywhere, which is a basic concept. And if I don't use multi-factor on every endpoint, all it takes is one failure in a ransomware event, and I'm owned like we saw, right? So the real gaps are in, things like understanding that threat footprint. We saw gaps in data backup and recovery, incident response planning, patient care continuity. Think about all the people who couldn't get their prescriptions filled or couldn't, get in to see a doctor. Like, these are big problems. This actually affected patient care, not just the financial book of an organization.
Right. And I think that was one of the big key differences. And we saw it, both from the providers not being able to get paid to the patients not being able to get their medication. So it definitely, sent shockwaves from that side of things. And I think the point you bring up around, the employees and, travel nurses and sort of that, the things that we as organizations are doing to address, resource challenges, whether that's through introducing new technology or introducing new organizations that we contract with, is making it, the job of the cybersecurity professional much more important and much more difficult. In terms of that, like the identity piece. Yeah. Tell me about that. Go ahead.
Yeah. Sorry, I was going to comment too, because you're like leading right into it. So we were fortunate enough to have Kevin Mandia, who's the founder of Mandiant and now Google Cloud, CEO of Google Cloud, speak at one of our conferences about a year ago. And he made this comment. He said, look, the only thing on the other side of when we fail to stop the kill chain, which means like we've failed to stop the bad guys from getting in, and they've started executing on ransomware, malware, whatever. The only thing on the other side of that is identity security. And his point was, look, the best you can do at that point is try to reduce the footprint by which they can sprawl, right? And he said the only other option is to stop credential theft, which is great, but it's really difficult to do with the technologies we have today. And so I want to be clear when we talk about change, like I'm not saying these are easy problems to solve or that every organization has every answer. But what I often see is we fall victim to this like iron triangle of project management, where you've got quality in the middle and you have schedule, scope, and budget on the points. And it's like, look, if I want if I want the schedule to move faster, but I don't increase the budget to scale, or I don't reduce the scope, my quality suffers, right? If I want to reduce the budget, I need to reduce the scope or the schedule, or my quality suffers, right? And so the problem is, I think we're settling too often for that trajectory of it's okay, but not better or best. And we've got to really focus on how we be the best, right, in this industry.
Yeah. And it's it's so complicated. I mean, that, just that, in terms of, and also, we've talked about this a little bit, the physicians and the clinicians, in that identity, it's like you put two-factor, it's annoying, I mean, how many times a day do we have to do it? So getting in, where you want to kind of balance that workflow, but you have to protect the data and the systems.
And that is that. And look, and I feel like that is a lot of that equation is on me as a practitioner and as an identity team. Look, traditional InfoSec, traditional cybersecurity, it used to be looked at as a sort of back office. It's all ones and zeros. It's black and white. Like you get this or you don't, right? Identity is this weird space where like we actually have to care about an end user experience, right? We have to care about their feelings. We can't be just another friction point. End users are amazing. They are so good at not only identifying where problems exist in the software, but at like finding ways around. If they don't like a process, they will find a way around it, even if it means calling up and creating a fire and whatever. So our job, frankly, is to find better ways to drive a better end user experience. And some of that looks like, hey, think about birthright access. If you're going to onboard a new nurse, well, if I know the department she's in or he or she's in, and I know the access that they need, I should be able to provision that out of the gate and get them rolling with relative efficiency without having to wait on a whole bunch of other things to happen. If that same nurse is going to pick up a shift in another department, it should be relatively easy for them to go into a portal, request that access, and they should be able to, in human readable speak, right, in their language, speak, request that access to perform that job. We make all this stuff really difficult sometimes, and it's due to other complexities, right? But I can tell you as we get better at data science as an industry as a whole, from a cyber perspective and from a healthcare perspective, like that gray area is becoming a lot clearer now on what that's going to look like. So I think there's a lot of opportunity for us as we move forward.
Yeah. Well, and I mean, not to say, we're trying to find the silver lining. We're always trying to find the good points, but in trying to find that, the clinicians and anyone who works in a healthcare system realize how important this stuff is now, right? I mean, at least everybody knows. So there's, in terms of putting those programs in place, even when you're dealing with your vendors, I imagine, for a health system now, they understand that they have to go through these processes of risk assessment and vulnerability assessment. Yeah. Are you seeing a change in that? Are there, places where, where are you still seeing resistance from staff? Are you seeing resistance from vendors as you guide your clients through these types of processes?
No, I mean, look, there's always the challenge of there's always the discussion of cost, and we can't just print money, right? Like organizations don't, especially hospitals. Think about most hospitals are not for profit, right? I mean, so there's there's a lot of fine lines in all of that, right? So we have to get creative in other ways. We have to look at operational efficiencies and whatever. But the reality is, no one's challenging, or at least at this point, I don't get the challenges of the validity of cybersecurity, the validity of doing things like risk assessments, or having data recovery processes, or an incident response playbook, or an identity governance program. Like these are all things that actually it's really helped this industry too, in terms of shaping what some of this looks like from a de-risking profile. Most companies carry cyber insurance policies now. And I can tell you, when I first heard cyber insurance, it's been 15 years ago, I was like, you've got to be kidding me. That's a thing. It's a real thing now, right? I mean, and it's because it's happening so often, but they won't underwrite these policies if you can't show proof of proficiency in these spaces in your InfoSec program, right? If you don't have an identity governance program, your premiums are higher. If you don't have incident response playbooks, your premiums are higher. If you can't do business continuity, they're higher, or they may not even write you a policy in the first place. And we know that I hate using the statement, but it just continues to be true and true. It's not a matter of if, but when something's going to happen. And we've seen other major organizations get hit this year, and a lot of it some of it boils down to some really creative, sophisticated attack, but most of it boils down to common human error and a gap in something as simple as MFA. Mm-hmm. Right. So we know that these are board level conversations now. We know that, the healthcare industry it's critical infrastructure. Things like Change Healthcare and this, this situation really sort of showcased again that supply chain component. So I don't see organizations arguing about, is this valid, or should we do this? It's more the matter of how on earth are we going to do this? It's a whole lot to pick up. And that's where I think it starts to fall back on us as vendors and software practitioners and whatever, to start to think about more standardized, more efficient ways of helping attack these problems at large, versus all the decentralized kind of capabilities and tooling that maybe have been available over the last, couple decades.
Yeah. No, absolutely. And I think, it makes it a non-negotiable. It doesn't make it any less expensive. Unfortunately, it probably makes it a little more expensive. The demand is high, but, it's that important. And then I think about, and that's sort of your internal governance and making sure your board is on board. But of course, the government has a role to play. They've certainly had, put a lot of guidelines in. I actually saw, in New York, they're requiring that health systems have, CISOs now, right? That's part of, the guidance. I was sort of surprised that some don't, but I suppose in smaller rural health systems and things, it's harder to have, a specific person internally for that. So where do you think, in terms of, as we look to the future, or, even where we stand now, what is the government doing right, and what more needs to be done?
Yeah, it's a great question. So look, the government plays a crucial role. There's no doubt. When you think about, even if you just look at NIST as a framework, as a cyber framework or security framework, that concept has been adopted by, I'm not the federal guy at my company, but he would say a lot of countries, right? And it's in the tens, if not more. And they have their own versions of it. But the reason is it's so rock solid in terms of its framework and approach. And it's something that these organizations, a hospital, for example, doesn't have to just go create their controls and practices, whatever, from scratch. There's a government framework driven for it. And there's actually specific ones with the HHS 405D specific to healthcare, right? That really helps. We have other compliance and regulatory things, SOX, HIPAA, PCI. I mean, the list kind of goes on and on. But again, I still think so. I think what we're getting right is we're talking about it. What we're getting right is we continue to see additional regulation, and Change Healthcare will, again, what happened here I'm certain we will see additional regulation likely coming around that. Things TBD, right? I mean, we are about to change administration, so we'll see kind of what becomes priority for the new one versus the current one. But, again, healthcare, it will continue to be, I think, front and center. Like I was kind of alluding to earlier, though, I really feel like we need to standardize on protocols, that unified defense concept, if you will, really a baseline. Interesting. There's an interesting approach going on in Canada right now. Now, obviously, that's a government-funded health system, right? So universal health system. But they have this concept of an RSOC, or Regional Security Operations Center, where they're sort of moving all of their security IT into an operations center that then fundamentally covers that security mechanism for that region's set of hospitals. So something like that sort of breaks down in our model, where we have independent hospitals and independent whatever. But if you really look at the other side of that coin, arguably some of the larger EMRs are doing this today, where, maybe a rural hospital can't afford to buy one of them and host one of them themselves. So these more regional hospitals are farming out their capabilities to those rural hospitals so they could use them as part of their patient care practices. So there's interesting things going on in healthcare that give us a lens into maybe what a model might look like that works within the US. But, we continue to fall back to, again, like, we've got to have cost efficiency. We've got to be proactive. We've got to do, we've got to do these things in a best practice way. But again, that decentralized approach, which I'm not saying is wrong. I'm just saying it's another level of, it's another thing to solution for. We have to think through what that looks like. Another thing to put out there is there's a great concept called shared signals that it was developed by some Cisco engineers, and now it's kind of getting it's a current standard. It's a shared signals framework. The general idea is, hey, look, I'm one piece of software. I'm only as good as I can see. But if I can publish and subscribe to events from other softwares, I can use those to make better decisions for my security. So we can sort of level up and say, hey, the collection of these security investments in a healthcare system now has more emphasis, more ability to protect, because we're communicating, right? So we start to centralize some of that management, and that's really what that's all about. So there's a lot of positive things coming.
Yeah. No, it is. I mean, the decentralized system makes it so much more complicated and so much more difficult to kind of manage. And that's not going to change. So how we can kind of, it's like you plug one hole and then it just all keeps coming. Right. And then I think, obviously a lot of our conversations this year are about, AI. I mean, I read the other day about, sort of the promise of using AI to help code, and then the vulnerabilities of coming with that. So not only are, the awareness and the understanding is greater, the threats have increased, but the number of ways to kind of approach it have changed. So talk to me a little bit about how, in these past, whether it's 1 year to 5 years, how kind of the response to these attacks is changing, just the whole industry, but also how healthcare organizations are looking at it.
Yeah. So I feel like it's a bit of a buzzword, but it's important. We are seeing much more interest in a shift to a zero trust architecture. And so the general idea there is, hey, I'm never going to trust. I'm always going to verify. And that's not necessarily asking a user to enter a password every 5 seconds, right? There's methods to support this sort of verification, but the goal is to make sure that I am the human on the other end of the thing that I say I am, or I am the machine that I say I am, or whatever it may be, right? So again, we've talked about MFA. AI is an interesting one because obviously AI can be used for attacks. So we can get a lot more sophisticated, a lot more scaled, and whatever. So that certainly increases risk for sure. But it also is a defense tool. It's our ability to really look for threat detection and anomaly detection and do automated incident response. And I think the other thing about AI that people get maybe a little confused is we're not always talking about the ChatGPT and Google Gemini and Microsoft Copilots of the world, right? Those are horizontal AI. They're very expensive to get into as a software company, and so that's why you see the tech giants have them, right? Really, what most security vendors are looking at is what we would call a vertical AI. They're looking at going deep in the stack that they support. So from a SailPoint perspective, it would be identity, right? But it's really understanding what we would call identity context, and how do we use that context to drive a better decision or detect an anomaly or whatever it may be. And the same is happening in your endpoint systems. The same is happening in, whatever, right, in your security stack. So these vertical AI capabilities are going to afford us a lot of protection, to be honest with you. But again, back to that theme of that centralization, we have to have a mechanism to share when we find something, so we can take all the proactive steps necessary to reduce or limit when we fail. Right? Yeah. Trying to think of what else. So we continue to see enhancements in encryption. We continue to see threat intelligence platforms. So again, trying to look at things at large. I really think, again, the big evolutions are, we're talking about this at every level in an organization now. There's no question anywhere that cyber is important. It's a matter of, right, what can we realistically get to and when, and where are those high risk components, and so those are the conversations that continue to happen.
Right. We're just kind of at this place where the technology is giving us more ability to protect and yet more threats at the same time. And you just hope the good outweighs the bad, right? And so, as we do, we always like to talk about some of the good things, the good things happening in healthcare. As you look to 2025 and think about, think back on this year, what are you most excited about? What do you think is some of the good stuff that came out of this?
Look, in absolutely no way, no prep whatsoever, you're the good thing. You're the good thing, right? So and I mean this, right? So in previous, and you go back even just a few years for me, right? When you're working for an organization and you're in cyber and you're trying to protect your healthcare organization, a lot of it feels like you're being fired at all day long, right? And it's so hard to get your head up above water, whatever analogy you want to use, that getting out into industry and realizing all the conversations going on about it can be challenging, right? What's amazing about this forum is being able to have conversations sitting next to a physician who I have no idea how to do the work that they do. They may not know the work that I do, but we have an intersection, right? We have a reason to communicate. And seeing the involvement from both sides, not in a heated way, but in a collaborative way, right? It's game changing in terms of what we can do. And then as you take those messages, again, we start to see all of this, at a board level conversation. I don't walk into organizations anymore and hear them go, what on earth is identity? Like that used to be a thing, right? I don't walk into organizations anymore and go and hear, oh yeah, our cyber budget has been cut. 99% of the time, it's something else that's being cut because cyber is so critical to their organization. And it's really, it's a matter of like, look, these can be expense-based investments because, we're protecting protecting from the inevitable, I guess, to a degree. But the reality is, what's so refreshing, I guess, as a positive take on all of this is that the conversations are happening. It's not just the frustrated engineer who can't make the change that they're passionate about, or the physician that can't get access to something, and frustrated with the tools that IT delivers. There is a collaborative conversation going on, and it's got a lot of momentum. So again, I think as we see more developments in AI, more developments in our data science and modeling, more understanding of what these attacks look like, more standardization of protocols, more centralization of that communication, this just gets better and better, right? For us as practitioners in cyber, but also for any clinical employee or clinical worker at the floor, right? And the patient ultimately at the other side of it.
Yeah, no, absolutely. And I think, awareness is so much of the vulnerability, right? I mean, in that the mistakes that are often made, which are just people not necessarily being educated on how to protect themselves. And a lot of it, I mean, I've heard you speak about it before in terms of not, a lot of that, sort of frontline vulnerabilities comes down to educating your people and communicating with them and collaborating across that. So right. I appreciate that. And and we've always covered cybersecurity and covered it as knowing that it is kind of fundamental to operations, but the interest is so much higher now, and understanding where it impacts clinical workflows and operations and the finances, right? So it really has become, much more of an everything discussion as opposed to just, over here. Speaking of, did you see the Julia Roberts movie, Leave the World Behind?
I did not.
Oh,
No.
you have to see it because not to give it away, but cybersecurity plays a bit of a role there. It's
I know the movie.
interesting.
I've not watched it, but I do know the movie you're talking about now.
Yeah. It's a good one. And they at some point the Teslas are all driving into the highway because they're all been controlled. So interesting stuff, but it's right. It's way up there. Everybody's talking about it, right? So I appreciate that, and I really love how you always make this just such an accessible topic, and it is an incredibly complicated, difficult thing for people to kind of get their head around. But you do a great job with it, Rob. So thanks so much for joining us and sharing with us your insights.
Yeah, thank you for the time, and as always, thank you for having me. It's been a pleasure.
Absolutely. Well, and we look forward to seeing you in January at Health Impact. And to everybody else, thanks so much for joining us. Until next time, stay vigilant and keep innovating. This is Megan Antonelli for Health Impact Live and Digital Health Talks.